The Bono East region has recorded a total of 58 COVID-19 deaths since the outbreak of the pandemic. This represents a case fatality of over 2.2%, a figure way higher than the national average of 0.7%. Dr. Fred Admaku-Boateng is the Regional Director of Health Services. He says the figures means there is a challenge with the way the cases are handled across the region.
If you look at our case fatality, which is about 2.2, way higher than the national figure, hovering even not 0.7, it means that there is a challenge with the way that we are handling the cases. And I can tell you a number of reasons. One of them is the atypical presentation of the Delta variant. The way it was presenting in people was quite different from the other ones that we knew.
Dr. Admaku-Boateng attributes the increased number of deaths to the late reporting of cases to the health facilities.
By the time you realize that, look, I am having a challenge, you report to the hospital very late. So you see one of the late reporting, that has been the challenge. And so you see, and then most of them are also happening in people with comorbid issues. And what we realize is that they may be having their normal drugs, but you cannot really control. They come to the hospital and you see that is what is the COVID. So one, because of the atypical presentation, not the usual things that we were looking at, that was one of them, and the time that they report at the facility.
He says as a means of helping rectify the challenge, the Directorate have trained more clinicians on the proper handling of COVID patients in other municipalities to help deal with case management.
We have heightened awareness among all health workers, especially aged people with comorbid issues, and more also people with all atypical presentation, because the COVID is not presenting us with the kind of normal. So we have heightened all the clinicians to be really be on high alert so that they can quickly pick the case. What we have also done is that, apart from Holy Family Hospital, we've been able to train other clinicians at Kintampo Hospital. And then the idea is going forward, we'll train other clinicians at Atebubu, Kwame Danso, St. Teresa, so that they can also manage the severe cases, and we don't need to also end the critical, and no, we don't need to refer all of them to one point, which will make the management a challenge.
Reporting for Joy News, Anas Sabit, Tichiman.